Good afternoon, everyone. Super excited to have you guys here today. My name is Robert. If you don't mind, just while we're waiting for other folks to join, can you confirm that you can see the PowerPoint presentation? If you don't mind, maybe just putting something in the chat, a thumbs up or a yes or something for me. If you can see the PowerPoint presentation. Yes, awesome. Perfect. Um, that is what we're hoping for. Well, that's the wrong background. Look at that. Huh. There we go. There we are. Howdy, Dr. Keck. How are you? Good to see you.
Good to see you, neighbor. Doing well.
Yeah,
And
I
yourself?
know. Things are good. Busy, but good. I'm really looking forward to today. I think today's going to be hopefully helpful and productive and insightful, but we'll give folks some time to get joining. So feel free to grab a cup of water or do whatever you need to do before we get started. Get started probably at 12:02 or so.
All right. Sounds good.
I believe we are. Jody,
Right, so we got two that are fingerprint clearance certified.
Hello. I'm just saying hi because we have so many friendly faces. It's so good to see you guys. Again, we're going to get started in about 2 minutes after the top of the hour. So we'll be hanging out. I do need to get me some background music. Otherwise, I feel compelled to like hum or sing, and nobody wants that. So we'll get started in just one more moment, y'all. Appreciate you joining. All right. Well, it looks like we have reached two after the top of the hour. So I want to honor folks' time and get us started. Thank you all so much for joining us for today's Power Hour on strategy and planning for health and human services. It's the end of the year almost. I know lots of folks are pivoting their attention towards next year. So we're going to get through a lot of great, exciting content today that I hope is really helpful and gives you some insights and strategies and tools. Please feel free to use the chat box throughout today's presentation. And of course, if you have a question you want to ask, also feel free to come off mute and just chime in. We have a lot of content to get through, but I am really excited for this conversation. I want to make sure that it's meaningful for you. So please feel free to chime in whenever, wherever, and however you feel fit. Um, so as we are getting going, there we go. Just a quick copyright notice. This is our content. Thank you so much for respecting that. Very briefly, if you're not familiar with Hess III Consulting, so we've been around since 2007, formally here in Arizona. We do a large variety of things in health and human services broadly. A lot of our work is Medicaid focused, child welfare focused, justice focused, physical health, those things. And then we also work nationally. So we've worked in about 47 states with other organizations. Very briefly about me, I have about 23 years of experience. I am a peer and a family member, and currently today am a legal guardian of an adult with a serious mental illness. My work has done lots of different things. Similar to the company, there are several additional members that are part of our team. So this is more just my specific experience. But a lot of my work has been with managed care organizations, working in other states, excuse me, and then about half of that work has been here in Arizona, working with providers. So you can kind of see some of those details there. And of course, happy to connect later if you want to talk more about that. What we're here to do today is first, we want to just define what strategy is in health and human services. Lots of people like to use this word, and I think lots of folks have varying definitions. So we're going to anchor ourselves in a general concept here. Then we're going to move into a market analysis that we have prepared, really looking at what has happened retrospectively in 2025. There's a lot going on, as well as some predictions on what we think might be going on or what we can look forward to in 2026. And then we want to discuss strategies for goal setting. So as organizations are considering strategic planning and thinking about next year, talk through some strategies for how to go about that, and then how you take that plan and operationalize it and convert it into a work plan to guide your organization's work. So lots of stuff to get through. So we're going to start off with defining strategy. There's lots of different definitions and concepts. I think a lot of people look at the concept of strategy uniquely and individually based off of their experience. I like to say that strategy is not a thing. It's not even a task. It's a process. And so that process is around using data to define the various priorities in your organization and where you might see the different opportunities. And another key component of that process is resource allocation. Of course, we can all set really, really significant goals, right? But if there's not then resources and prioritization put behind that, it's unlikely we might achieve those goals. A couple of other definitions just to kind of build general consensus. Clay Christensen, who is a renowned professor over at the Harvard Business School for many, many years, he likes to define strategy as long-term commitments. And I like that definition a lot because I think we often think of things as 1 year at a time or quarterly goals or monthly goals even. And the intention behind like corporate strategy and business strategy is, we're looking multi-years out, and it really does guide key investments that we want to make in our organizations, in our operations, in our clinical programming based off of our understanding of what's happening in the environment. So I really like that long-term commitment element or concept. And then again, you see in these other definitions, emphasis on allocating those resources and kind of the guardrails that we use to guide decision making moving forward. So once we define strategies or priorities for the year, those then become the guardrails that guide our work. Is this keeping us towards our North Star? Are we headed on track and towards the path that we set out? So very high level, but also wanted to unpack that there are multiple types of strategies inside all health and human services organizations. So you do have your corporate strategy, and that can be your governance structure, lots of nonprofit organizations, and how you can structure your board of directors, things like that. For-profit organizations, your ownership structure, and working with investors, all of those dynamics, play a role, not only in how your organization functions and operates, but also how you achieve your goals. And so considering those strategies is unique, right? And then looking at operational strategy, your management, your operating model, again, looking internally. So, not your governance structure, but internally, the staffing positions, who reports to who, like there's a lot of different impacts, that those things can have on the success of your organization achieving its goals. Your revenue strategy, I think, is pretty straightforward. But in our world, is it, we'll talk later about like payer mix and things like that and figuring out navigating, especially when resources are becoming constrained, which we'll talk about a lot today. How can you impact or adjust your revenue strategy for sustainability? And again, that's a big topic for today's discussion. Marketing communications. I'm not going to go through all of these, but just wanted to kind of broaden the lens that when we say strategy, we're not just talking about a strategic planning activity or a day, although that's a part of the process, but it is about like holistically diving into the layers of the organization and really thinking strategically about our operations, about our goals, how our resources are currently aligned to achieve those goals in these various domains. And then another quick, way to kind of bring all of that home is to look at the intersection of your industry analysis, again, looking at, what's going on in the market, looking at, again, like all of the different types of strategy that we just talked about, the business model, and all those different layers of it. And then what is the strategic positioning within that? And so figuring out how those things work together is really what we're talking about when we're defining strategy for today's conversation. And so we're about to go through a lot of rapid fire information, y'all. So I hope I hope that you've got a pencil handy. To feel free to take some screenshots if you want to. And the data that I'm about to review is publicly available. It is posted on our website, and we've even got a release scheduled at the end of today's session, and we will email out this information. So again, feel free to take some screenshots if you want to, but also know that this stuff will be available to you after today's session. So we took some time to go through and look at what's been happening in Arizona. And there's quite a bit of stuff happening. So we wanted to break down some data. This first graph looks at two different things. It looks at like population growth, how many people live in the state of Arizona, irrespective of their health or human service engagement, enrollment. This is just, top line population. And you can see that Arizona continues to grow, something that we've seen, markedly over the last couple of years, especially starting during COVID times, 2020, that trajectory is there. And then the second row that's down here, this is showing the access population. And you can see that it kind of very gently, balloons in the 2020 to 2024 window, and then we started to see some contraction happening. And this next diagram kind of demonstrates that much more clearly. So one big thing that I think is impacting everyone that works in Arizona Medicaid is this. Enrollment numbers are changing dramatically over the last couple of years. Now, for folks that are curious about drivers of these things, of course, during COVID-19 and the public health pandemic, the CMS removed the requirement for eligibility redeterminations. And so we were no longer taking people off of Medicaid. And that is what really contributed to that ballooning that we see that took place. And then because again, that's year over year. So this is a rate of change, right? So that's year over year growth that you're seeing from 2020 to 2022. And then at the end of the public health pandemic, we had to reinitiate eligibility redeterminations, which meant that individuals, were determined to no longer be eligible and could not stay on the Medicaid rolls. And that's where you see those dramatic drop-offs or reductions in enrollment in 2023 to 2025. And it's important to note, like, we are still seeing that in 2025. So, roughly, I think 12% of the Medicaid population has not renewed their coverage or is no longer enrolled. So we're seeing this enrollment year over year, largely attributable, of course, again, to the public health pandemic. And then, of course, everyone knows in Arizona of lots of other dynamics going on related to Medicaid fraud and those things. When we look at it month over month, just for the last year, again, we kind of see that trend that we were discussing. It's been pretty steady. Enrollment has continued to reduce month over month every year, or I'm sorry, every month in 2025. And so for the total year, that's about 14.42%, averaging about 1.17 or 1.2%. So the reason I share this is everyone is probably aware Medicaid enrollment is what's also tied, that's what the resources and the funding for Medicaid is tied to. And so any organization that has experienced a 14.5%, reduction in a single year, is going to be experiencing a very significant contraction. And for us as an industry, the Medicaid industry in Arizona, that is a significant contraction. And we're going to talk about that theme a lot as we go through the rest of today. So then wanting to kind of look at, what are the drivers of that? What's going on? Why is that reduction happening? And there is actually a notable reduction in applications. Folks are not applying to participate in the Arizona Medicaid program. So while yes, there is some attributable to fraud and eligibility redeterminations, all of that is there. Yes, all of that is in there. And there is this trend where folks, either because their income, has come up, whether it be the political environment, undocumented individuals, like all of the, contextual drivers are likely contributing to just this overall reduction in folks applying to participate in the Medicaid program. So, wanted to definitely call out, it's not just one thing, right? There are lots of variables that are contributing to the reduction in Medicaid enrollment that we're seeing here in Arizona. When we look at this by health plan, it's pretty consistent across the board. So pretty much all, and this is the ACC line of business, so all Arizona Complete Care, forgive me. I was about to say Access Complete Care, forgot what the A stands for. So we see uniformly, very consistent reductions in health plan enrollment across the various health plans. And that is substantiated here. Again, where we see rates of change, there is pretty consistent proportional reductions. All of them are hovering in about the 1.2 to 1.3%, 1.5% ish month over month. So again, it's not happening at a specific health plan. It is happening uniformly across the board. When we look at the SMI population, so again, that data, the last two slides were Access Complete Care, Arizona Complete Care, forgive me. And then now we're looking at the SMI or the REBA population. Similarly, we are seeing reductions in the SMI population. And so month over month, the rate of change, we're seeing about a 0.25% reduction month over month. And for the year of 2025, we're down about 3.5%. So it's not as significant as what we're seeing in the ACC business, but it is still a reduction in individuals that are determined eligible under the SMI classification. When we look at the DCS CHIP population, so DCS CHIP is for individuals that are enrolled in child welfare. I do want to call out that this data is Access DCS CHIP health plan enrollment data. So this is not, it's similar, it's related definitely to the number of children and youth that are in the foster care or adoption programs or system, but this is about their healthcare enrollment. This is their insurance. And so similarly, we are seeing about an almost 11% reduction in enrollment in the child welfare health plan. And month over month, we're seeing that as well. Y'all probably recall we did introduce a new director at DCS. And I think someone else said this at another presentation where they were reviewing similar data. Actually, I think it was Director Patak herself that said this. When we're talking about kids enrolled in child welfare, we actually want to see these numbers go down. We do not want to, have children in out-of-home placements or relying on, the foster care system. We want to see those families unified. So while the other numbers, where we typically want to see access to care and hopefully want to make sure we're giving coverage to as many folks as are eligible, here's where we really want to celebrate the success in this reduction in enrollment, because that's indicating or implying that we're keeping kids at home with their families, which I think we all agree is probably a good goal. And then looking at the All-Tex program. So interestingly, the All-Tex program is the only Medicaid program that has grown this year. And so in 2025, you saw, ACC has reduced, the SMI population has reduced, DCS has reduced, but All-Tex enrollment is up about 3.85% for the year, which is, again, just an interesting data point to follow. You do see this very interesting thing that happened in January. So for folks that are following the all-tax system, you may recall or be aware that there was a procurement that took place about 2 years ago. Those contracts were awarded, and then during the implementation process, there was a stay. So this is just Robert's 2 cents. I'm just assuming and making a guess here. I have not asked Access or someone at Access to verify this for me. But this transition that we see in January is very likely attributable. This change is likely attributable to those awards. I could be totally wrong about that, and definitely welcome anyone else's insight if you're on the phone and have more insight to me. And then once that stay went into place, we see where they would have stopped, member transition or any of that work. And so again, I don't know that that's 100% accurate. Definitely open to other folks' input there, but it's just a contextual driver that may be impacting or influencing the data that we're seeing. Does anyone have any other insight or comments? I'm just curious. Definitely feel free to come off mute if you would like to. Just curious if anyone has any other thoughts on that. All good. No worries. I'm looking over here. Sorry, because that's where all y'all faces are. So we're getting me lots of monitors.
Robert, it's Carmen. I would agree with that.
Oh, good. Thank you for chiming in. And so other things that are coming up and kind of rolling off that Altex project as we just described. So they did, following the protest that took place, Access did cancel the initial awards, and we are expecting a new procurement next year. So in essence, based off of the findings of that protest, Access decided to cancel those awards and will be issuing a new procurement. A new procurement obviously impacts systems dramatically. There's lots of opportunity when there are new procurements coming, both for providers as well as for health plans. And so if you work or play in the all-tech space or are curious and interested in working or playing in the all-tech space, now is a great time to be paying attention to what's happening there. Folks also know we have a new Medicaid director here in Arizona, and we're very excited to have her announce. So new leadership, of course, always brings different ideas, new approaches, all of those different dynamics that might be changing the way the system operates. And again, we're talking, contextually the environment in which we're operating in, and we will get to how this informs our strategy. So again, I think in your strategy development process, having an understanding of the environment in which we're operating will help you identify where you can pinpoint growth or pinpoint changes, whatever you need to do in your organization to continue your work. So again, new leadership typically brings new approaches, new relationships, new dynamics. So definitely a great opportunity to be engaging and connecting with Access and getting to know our new director. Folks are also probably well aware that as a part of HR 1 that happened at the national level, states were given an opportunity, and we'll discuss HR 1 in just a second, but states are given an opportunity to bid on and apply for rural health transformation funding. At the federal level, this was about $50 billion. Rough math, we don't actually know the answer here, but we can assume there's 50 states. They gave out $50 billion. Maybe there's approximately $1 billion coming to Arizona. So Access in the governor's office, ADHS, there was a full court press here. Everyone really rallied together as a community. It was very cool to see and to witness. Really came together to identify what are the biggest priorities in Arizona and how can Arizona benefit from a potential infusion of $1 billion into our healthcare system. This slide is actually pulled directly from the governor's office. This is a very high-level summary of what the governor's office submitted in the rural health transformation proposal to CMS. As far as I know, we're still waiting on a response, and we do not know what we were awarded or what the funding is allowed for. However, as we are thinking about what's going to happen in 2026 and our strategies, this is a very important thing to be aware of, to be looking at, to be studying, read the proposal if you've not had a chance to do that, and then see where these strategic investments or these priorities as they're presented may align with your work internally as well. So again, it's a very exciting opportunity for us in Arizona to get this infusion of capital, and I'm very excited to see kind of where it goes. I do understand, and again, if anyone has other insight, please chime in here. But last I heard, we are expecting once the feds award the funding to the state of Arizona that there will be some procurement opportunities, so RFPs that will be released based off of the award to issue subgrants out. I don't know if that, maybe some of it will go to managed care organizations and then, ADHS and the public health departments, and then, a portion would become available via grant funding or RFP responses. But definitely something to pay attention to and keep your finger, keep tracking, right? And then for those of us working in the housing space, of course, HR1 brought with it, and actually this executive order from the White House that was issued back in July, brought with it some significant changes to the HUD, so Housing and Urban Development, their continuum of care program. So this historically has offered a significant amount of resources. I want to say it's about 30 or $40 million. I could be wrong. I know we've got lots of housing folks on the line here. So please feel free to let me know if my number is way off here. But at least in Maricopa County, provided a significant pool of money that was used for permanent supportive housing, actually paying rent. And this is HUD money, not Medicaid money. So again, I want to make sure that that's clear. But the federal government in this new procurement has significantly changed the model to where they are no longer prioritizing permanent supportive housing the way that they used to. They are now prioritizing transitional housing with a service requirement. And so that requirement is 40 hours a week, which is significant unless you are employed, disabled, or over the age of 62. And this approach dramatically changes the way that housing services will be available in the state of Arizona. And so expecting housing to continue to be a significant driver or significant priority for us as we kind of move into this next year based off of these changes. I want to take a quick pause. Any questions, comments? Again, if you've got more insight than me, I know we got a lot of extremely smart experts on this call, so please feel free to correct or clarify anything I said. But quick pause for questions or discussion. All right, no worries. We will just keep on churning. So that really is a reflection of what has happened in 2025 so far, right? And so looking ahead into 2026, what are the things that we can anticipate, that we can expect, that might be impacting us here in Arizona? So I only pulled out, we know HR1, so the big beautiful bill, has a lot of different requirements and priorities and changes that are in it. I just extracted the things that are due or will need to be taken care of in 2026. So there's a couple of things that have already been implemented. This slide reflects, the priorities of 2026, and then there's several other things that are scheduled or slated to come out after 2026, so into 2027, 28, 29, and 30. So in here we see some really significant changes to financing. There's a lot of restrictions on coverage and benefits for undocumented immigrants or just immigrants, depending on their status. There are some changes, I'm sorry, the addition, which is a significant one, by the end of 2026, work requirements will be coming into play, or they're calling them engagement requirements, which can include education, work, or volunteering. So similar to what we saw in kind of that HUD continuum of care funding opportunity, we're definitely seeing a push towards that work requirement. I'm hoping that's setting off alarm bells in people's heads as we're talking about that, or just ideas, right? Stimulating creativity there, because I think there's going to be a lot of focus on that element for us. Of course, we see some price shifting and different things in here. So, lots of changes coming in 2026 based on HR1, the big beautiful bill. I can't take credit for this analysis. I found it on the internet, but it definitely provided some context. And I wanted to make sure that we consider not only what's happening in Medicaid or in a policy perspective, but what's also happening just kind of socially and economically. I am not an economist. I've taken some classes, but we are still seeing population growth in Arizona. And while it is not as dramatic or significant as we saw in the last 5 years, it is still something that is continuing here. Employment industry, Arizona is actually booming, but it's booming in certain sectors. So lots of technology, AI. I know we all are familiar, with chip factories and server mega server hubs and all of those things. And there's lots of dynamics around those. But universally, top line employment opportunities are going up, which is something to consider. Household income is intended or is expected to grow, and there's some, of course, you see in here some unique, interesting variables in here. And then housing, the housing market, we are expecting that to soften. And again, for those of us that work in housing or run and operate housing and trying to house people, this has obviously been such a huge challenge for all of us because the cost of living has become so extreme in Arizona. And so hopefully again, I don't know that it's going to be a reprieve. We're certainly not headed back to, 2015 rental rates and things like that. But hopefully we will start to see some of the housing market soften. So it'll make it easier for us to provide housing supports for folks that need them. We also have some additional procurement. So we talked previously about the all-text procurement that we are expecting to drop in 2026. But we are also expecting, and an official date has not been announced, but either in 2027, 2028-ish, we probably can expect the ACC REBA business or contracts to also drop. So again, and about a couple months ago in the summer, or when was this? Yeah, it was probably summer-ish time. Access had started, going through the process of doing some focus groups and listening sessions that we see here on the the left-hand side of the screen, which is kind of the flag, for them that they are starting the process of engagement with the community to kind of start crafting priorities for that proposal. After that is when the all-text bid was canceled. And so, again, now I think the priority is currently on all-text, but can't lose sight of what may be happening in the ACC REBA business the year after. So again, procurements bring a lot of opportunity. So I just want to reinforce that. And so if you've not had conversations with your MCOs, with access, with stakeholders, about priorities and how you might be able to contribute innovation or fill gaps, like that is something to be germinating on right now in this moment. Another big system thing, we've really got this perfect storm of like these big giant system things happening all at the same time, right? Is our 1115 waiver. So the 1115 waiver is how state Medicaid programs essentially customize their programs to their state. So, it's everyone is probably aware of Medicaid. It's a federally mandated program. There's a minimum set of things. You have to cover these services. You have to offer these medications. You have to do X, Y, and Z. And then states are allowed to customize and say, well, for us, we really need an example here in Arizona, our traditional healing benefits for tribal members, which just went live and is a huge success and a beautiful contribution to our system. But like that happens through the 1115 waiver. So a lot of our, substance use treatment, our managed care system, just the fact that we have MCOs is actually a modification. It's something that has to be approved and renewed. So this is really big. This also is something to absolutely be tracking and following. Because whatever gets approved in the 1115 waiver will find its way into MCO contracts, which will find its way into your contracts, right? As providers. And so following these big system policy things will help inform the strategies and help you identify those opportunities to make sure that you're, again, continuing to make the impact that you want to have on the lives that you serve. And of course, how could we omit the fact that we're entering an election year? So election years bring their own fun dynamics. Of course, we have incumbents and we have, other folks that are campaigning to become the governor, become state representatives, become state senators. You've got all of these different dynamics. And this is not a political comment. I'm not, offering any type of pro or con or support here. But I am calling out that in an election year, there's a lot of sensitivity to that election. And I put this quote up here, and I want to make sure that it's received gently because that's the way that it is intended. But in an election year, you typically see the Rose Garden rule, which basically means, we want to, incumbents want to make sure that there's not a lot of noise. We want to make sure that, there's nothing that would detract or negatively impact what a campaign cycle might look like. And, I'm social worker. I'm here because I like to help people. I'm here because, again, I'm a family member. I live this whether or not whoever's in office, right? But this is a politically driven or politically impacted, influenced, whatever word you want to use. This is a politically impacted system. And so we have to pay attention to what's happening at the governor's office, at the state house, at the Senate, and federally as well. And so, of course, all of those things are going to impact next year and what opportunities present themselves, how the state operates and works, and again, kind of how they're prioritizing things. So at a very high level summary, what we expect to see is that we do expect Medicaid will continue to contract. Personally, this is just my sense. When you look at current enrollment, we are pretty much getting back to about 2019 levels, so before pandemic. So I would imagine that market contraction actually slows down. I do still think that there will be some contraction attributable to, of course, household income increasing, political environment. Again, our HR1 removes eligibility for certain populations, or at least with the addition of work requirements engagement requirements, those types of things. We will probably still see some trimming, but I'm hopeful that it's not going to be to the extent of 14%, right? I couldn't throw out a number if you asked me, but definitely hope that slows down. But it will continue, right? Because of HR1, as well as the rural health transformation funding, I am imagining that is going to be the talk of the town and the biggest priority, or at least not the biggest priority, but probably the most conversation is going to be around that funding as it gets rolled out. And so again, keeping your eyes on that and following it, super helpful. There is definitely, I know I mentioned this earlier, that if the lights are not flashing around, engagement, work, employment, volunteering opportunities, like absolutely start looking into those programs, figuring out how to build them, how to offer them, how to connect people to them, whether that be through partnerships, et cetera. I mean, this is how we're going to keep people enrolled, which means it's how we're going to keep people managing their mental health, managing their physical health, managing their substance use conditions, all of those things. Because of what's happening in the HUD continuum of care funding, I don't think that will impact us, or we won't see the impact of that until later in the year, and maybe even 2027. But we do need to prepare folks, right? If you've been in permanent housing for a while and you're expecting to be able to continue that, there's this transition to that transitional housing model, or the emphasis on transitional housing. So housing might get worse or harder, is what I mean, more difficult for us to manage and navigate. It very likely will, right? And we all know the relationship between people having a roof over their head and their ability to meaningfully engage and manage their health and behavioral health and substance use conditions. And then, of course, waivers and procurements, lots of things. And again, I think that the election year is just going to largely impact the how we work, if that makes sense. Again, you're going to see folks wanting to be strategic and proactive and thoughtful. An election year, similar to a procurement year, is filled with opportunity, right? And so it's definitely, depending on who your preferred candidate is or whatever, there's opportunity in supporting them and to make that a strategic use of that cycle versus an impact or something that's negative. So that is the summary of the Hess report. And so I do want to pause one more time before we start diving into strategies and see if anyone has questions, comments. I definitely, if you at least will put this in the chat box for me, I meant to create a poll and I didn't, would love feedback on the content that we just reviewed. What was missing? What did you like? What do you wish that we had more of? Because we are hoping and planning to continue publishing that type of data for folks, hoping that it will give people more resources and tools that they need to guide their organizational strategy, especially as we move forward in this year. All right, Robin, I see that your hand is up. Yes. Hello, Robin.
I'm coming off a mute. I heard some other unmuted things. So
That's all good.
in any event, so answering your question, this was great, Robert. Thank you. I really appreciate the high level but concise, clear summarization of all those plates that are spinning in the air right now at a federal level and sort of how you quantify some of that at a local level. I was curious related to the HB1 employment education tracking exclusion eligibility possibilities for so many people out there. Have you heard anything on the street or from our colleagues at Access about whatever technology infrastructure is going to be used, built, architected, interfacing to do that? Because operationalizing that is a big and heavy list, as you know. And
Absolutely.
just sort of wondering what's the pulse on that topic?
Yeah. So I've heard lots of different things. So I know a part of the rural health transformation, funding that type of technology, the use of AI platforms, interoperability, all of that is kind of built in there. So I do believe, and I recall that allocating some resources to support the engagement requirements, is identified as a priority. I also am aware that there are vendors and platforms and tools and, coming out of the woodwork saying, we've got a solution for this and here's what you can do. I am not aware, and of course would open this up, for anyone else on the call that may have heard, an official kind of announcement or strategy from Access or the governor's office or someone else. I'm not aware of an official thing, but the end of the day, we are very fortunate in Arizona where things like employment support and peer support and job skills training are covered benefits, right? And I know that there are some providers that I work with and, that I engage with that are doing really cool stuff in this space. And so I don't think that there's going to be one app to rule them all, right? Or, single solution that everyone is just going to magically adopt. I just don't see that. So I do think it's incumbent on providers to start figuring out how they can address these programmatically. And that might be where we see, that technology adoption or some of those things, at the provider level, not necessarily at the state level.
Yeah, I guess the pin that I put in that one is the expectation is at a person level. We as people and the citizens are going to need to have access to tools. And so what I'm really interested in is sort of keeping also the pulse on that, because it's one thing to talk about what we might have infrastructure for that provider orgs might do to support people, but there's a whole plethora of people out there that are going to have to do this themselves, and was curious about what the plans are to educate, ensure people know how to access that stuff. So big question, lots of logistics to play out, but thank you for bringing it to the attention. Thanks.
And thank you. Awesome. All right. I'm going to churn us forward because I know we've just got about couple minutes left. Well, we still have a lot to get through, I guess is my point. So, all right. So what do we do with all this information, right? That is a lot. And for some folks, that was probably too high level to be like, I can't connect those dots. And totally get it, right? And for other people, it's like, cool, I understand all of those problems. Those are the problems I face every single day, right? And those are the things that keep me up at night. And those are the things that, are forcing some really unpleasant changes in my organization, because I know we're experiencing that across the board with financial limitations and constraints, driving layoffs, driving closures of programs and clinic. Like it's tough. It's so hard. And none of us, are enjoying that process, right? So what do we do about this? How do we get through this? And ultimately, for strategy or for goal setting, how do we translate that data into smart, measurable, attainable, realistic, time measured goals that can guide an organization? So I'm going to give you Robert's greatest hits here. I'm going to move a little bit fast through some of these things, but again, recordings available, slides will be available, and I am always happy to chat. So there's always that. So just recommendation number one, get lean, right? If I know we're already operating lean organization, I was just having a conversation with someone a couple weeks ago, and they were asking me about like profit margins in health and human services. And they're like, what do you guys make? Like 30, 40%? And I laughed in their face because I know most organizations, are shoestringing it, 1%, 2%, zero, right? Negative. And so I know there is a whole cohort of us, out there that there is not more lean to get, right? Financially speaking. But there is still opportunity to look at waste and processes, inefficiencies. To Robin's point, where are we doing stuff manually, or where's our technology not meeting our needs, to automate, to streamline, facilitate the work that we're wanting to do. And so to quickly walk through this, I always include mission and vision and values here, which I think is probably a little curious for some folks, because you want to anchor yourself in your why, right? Like what are we trying to accomplish? Who are we trying to serve? Why are we here? And allow that to then inform the decisions that you need to make around, changing processes, eliminating waste out of the organization. Like, are we doing things because we've always done them, or are we doing them because they're core to our mission and they're worthwhile, meaningful investments? And therefore, while it might be stretching for us, we are going to in fact still do it because it's part of who we are, right? It's our ethos. So having clarity on that mission, vision, and values will anchor you and help inform the decisions you need to make when you're looking at processes that need optimized or eliminated, right? Or added, right? Of course, drilling into those evidence-based practices, I know evidence-based practices come with costs often, and so that can be costly and charge. And there's also very clear, they wouldn't be an evidence-based practice. And I mean like recognized, like SAMHSA, go on their website, evidence-based practices, right? But relying on those it is beneficial because they work, right? There's proof, there's evidence. They wouldn't be an evidence-based practice if there wasn't a ton of data that said that they work. And so, as opposed to relying on homegrown solutions and things like that, going back to basics and going back to, kind of where those core things are, and where they make sense in your organization can help, again, you really get back to effectiveness, right? Of course, everyone knows about stabilizing cash flow, improving quality, and just because of where we are in the technology disruptive age that we're in, if you are only using AI as an enhanced search, then you're missing some opportunities. It is rapidly evolving every day. New tools, new models, new ways, new apps, ways for it to help support standard operations. And so, Lean Six Sigma and looking to AI as a potential solution, those two things will work in concert with another by identifying, okay, what are the non-value added processes, or where are we wasting our time, or what is the stuff that we do 25 times a day or 25 times an hour? Those are the perfect workflows, tasks, functions, whatever, to look at for Lean Six Sigma to, how do we, if it takes us an hour to do this now, how can we reduce the process or enhance the process to where it takes us 30 minutes tomorrow, right? And similarly, those same processes are probably ripened for AI utilization, because you can train it to do those redundant things very, very easily. And more on an operational level. Let me be very clear. I'm not referencing, getting AI nurses and therapists and coaches and stuff like that. I'm more referencing like auditing processes and workflow, like forms that need to be filled out, quality management stuff, even HR resources. Like, there's a ton of opportunity in those spaces on the operational side to streamline your back of house, which will make your lives hopefully a little bit easier. Getting agile. I know that this diagram is a little complex, but the concept of agile and why this is on here is that, you set your goals, you figure out what you want to do, you do some stuff, and then the magic of agile is in this like checkpoint, this check-in process. Typically, like in like manufacturing production, this toll gate happens no less than every 2 weeks. It's a very tight cadence, right? And so the point though is that you do some things and then you taste test it, right? Like if I always like to use cooking as an analogy here. So if like you're making some pasta sauce, right, from scratch, and you start off by doing some stuff, but you got to taste test it to see where it's at. What does it need next, right? And then you might add some more salt or basil or whatever it is you put in your pasta sauce, right? And then you got to taste test it again. So you got to do that in your organization as well, and that's how you kind of get yourself to that perfect recipe for success for you. So the point of this slide is to build in those feedback loops, which those feedback loops should be directly to your customers. Customers in our world, well, by definition, customers are typically the person that pays you. So in our world, that's obviously mostly a managed care organization or a state or a grantor. But then we also have these members, right? And the people that we're serving, our clients, our patients, our guests, our individuals. And so we kind of have to look at both of those things. And so by building a stronger relationship with your payers, to do check-ins with them, like how is our financial performance? What's our readmission rate? How much, money have we saved through our iterations or through our evidence-based practices and our model? That data is going to be critical to your success. So, build that relationship with those MCOs or access or, again, grantors, whoever's paying you, and make sure that you're getting constant feedback loops from them. And then doing the same things with, the patients, customers, members that you are serving to make sure you're kind of hitting both sides of that. Through that, you'll find out what matters and what's important and what works, and you can cut out the stuff that doesn't. So it does help you kind of get to that lean, kind of more agile approach. Another opportunity, of course, is self-disruption. This is, some people call this transformation, organizational transformation or redesign or whatever word you want to use here. But the intent is do some different stuff, right? It is best practice to not completely blow up your organization all at the same time. But if you are looking, at your agency's, income and expenses, and you're seeing that, program A is, staying afloat, program B might just be slightly profitable, but program C is just hemorrhaging money month over month, right? That might be the area that you want to focus on, say, okay, we need to reconsider what's happening in this program over here and figure out how we can tweak it, change it, modify it, even significantly if necessary, to make it sustainable, because we can't, of course, afford to be losing month over month in a particular program. So high level, there's the emotional process of embracing change and being comfortable with that, especially when we're, being stressed and experiencing so much pressure from so many different competing priorities and dynamics. And I mean, everything that we've talked about today, I mean, there's a lot going on, right? We are all backed into a corner in one way or another. And so using that, it's difficult to be creative in that space, right? When your prefrontal cortex is stressed, it's difficult to be creative. So finding the space and the time to ground yourself and be able to get there so that you can look at this strategically, getting on the mountaintop, right? Or get on the balcony. There's lots of different ways you can phrase that. And then working with your teams to, of course, do all the things that are on here, challenge your assumptions, foster creativity. And again, listen to your customers. Listen to what managed care organizations are telling you that they need. I know that that's not pleasant for many people. I know that we don't like what they tell us regularly. I've been on both sides of that table, so I fully appreciate and understand that. But they are your customer. And so finding out where you can meet in the middle, or not necessarily, you may not necessarily be able to do everything that they're wanting or meet their needs the way that they're wanting to, but how can you figure it out? How can you make it work? So I often say the answer is not no, it's how, and kind of forcing yourself to get creative and iterate, again, challenging those assumptions, figuring out how to do that. And then similarly, listening to the needs of the customers, patients, members, that group of folks, and figuring out, okay, last year we were able to offer you this, that funding is no longer available. So this is what we can offer you this year. And with that change, here are the gaps that are identified. Are there alternative resources that we can use to supplement, again, grant funding, donors. I mean, there's all kinds of other ways to raise money and engage resources, right? Or can we find another way for you to get that same need met? And again, I know that we are strapped so thin. Um, we just are, right? And so I think uh, we all probably feel like we can't stretch anymore. And I don't want to say we need to stretch further because that's not fair to any of us. But I do think that we gotta just keep on being creative, right? And again, pulling together, sharing resources, collaboration, we'll get there together. And this Winston Churchill quote is just probably a little insensitive after the way that I led into that, so forgive me. But using the crisis that we are experiencing as a system as an opportunity. It is true that in times of pressure and when we are stretched to the max, we do find new ways, we forge new paths. And that's kind of where we're at. So, continuing conversations and with your colleagues and with your staff and with your teams and with your members and with those payers, is how we're going to get there together. I know that that is probably too rosy and not very helpful, but it is true. We will get there together. Next opportunity is diversification. And we're going to double click on contract revenue. I've talked about some of this stuff already, but just wanting to expand the net, right? Expand the lens on all of the different ways that health and human services can be funded and is also like traditionally or typically funded, right? I have a lot of success with organizations helping them pursue grant funding that fills gaps, that Medicaid doesn't cover, right? Using and engaging donor programs, legacy giving, individual donors, monthly donors, like all of the stuff, big gifts, all of those things, organizations frequently make, hundreds of thousands, if not millions of dollars, with really robust programs in those avenues. So if your organization doesn't have that stuff, it might be time to start considering it, right? And then let's double click on this contract revenue, because again, I know a lot of us are so dependent upon that. Oops, I don't know if that quite double clicked the way that I wanted it to, so forgive me. This is just illustrative. This is nobody's data, but it's just intended to be illustrative. And every organization is going to look different, right? Looking at your current payer mix today, let's just pretend, that you're 65% Medicaid organization. There are organizations that are 100% Medicaid. There are organizations that are 10 or 5 or 0% Medicaid, right? The audience for today are folks, that work in that space. And so if your current mix is about 65%, strategically thinking about how we can adjust that and start diversifying those revenue streams, because we know that Medicaid is contracting, right? We know there's a lot of volatility in the Medicaid system right now. That is not to say that we abandon members and those that are relying on Medicaid for their health care, but as an organization, we need to keep our doors open in order to serve those folks, right? And so looking at how we can use our payer mix and diversification in the payer mix to bring sustainability to the organization so that we are still available to serve those Medicaid members and those vulnerable members when they come in our doors. So that's going to look totally different for everyone, 100%. But it's just definitely, if you've not taken the time to look at that and then identify, where you might be able to increase, commercial payers or employee assistance programs or VA or all of those other sources, definitely, is an opportunity to consider that. And then also in that diversification is looking at the markets that you're working in and of course your products, the services that you provide. So I always like to joke because this is real. I came up with this all on my own, and then I found out that someone else had done it like 20 or 30 years before me. So this is called an Ansoff matrix. And in essence, it provides a framework for growth, looking at, risk mitigation and how organizations can grow. Expanding your existing services in your existing markets has the lowest risk profile because you know your audience, the regulations, you know how to do that, the book of business, you have all the standard operating procedures. It's great, right? You can expand those existing services, but move them into new markets. So like if you only work in central Arizona, is there a need in northern? Is there a need in southern? If you only work in Arizona, is there an opportunity in New Mexico? Is there an opportunity in Nevada? Lots of organizations, Arizona providers are scaling across the United States. And we're seeing that because we do good work in Arizona and folks really want our programs and services. So if Arizona's volatility is too much and you can go make some safe, secure funding, up in Utah, and that balances the organization as a whole, then again, you're creating that same sustainability that you need to stabilize what you're doing here in Arizona. And then, of course, adding new products or new services. So if you've only done behavioral health, can you add, another complementary service? I use this tactic. I always call them like expansion services or extension services. Using this tactic is a great way to meet more of your customers' needs. And that's really how to frame this, is around how can I meet more of my customers' needs by adding those programs. So if you only bill 5 codes, right? Is there a 6th one that you can add? Or levels of care, really looking at all the different ways. If you are planning to expand services and programs, I do highly encourage you to talk to your managed care organizations before you do it to make sure that they need those programs and services. I know lots of folks like to, if you build it, they will come. And that's not always the case, especially in a shrinking population, in a shrinking environment. We probably have a little bit of a surplus, so it's something to consider, right? Engage with your payers before making any significant capital investments. I know that we are at our time and we are not going to probably get through all of this. So I'm going to try to plow through this real fast, and forgive me if we end up going a little bit over. As you can see, just kind of that reminder, we've got a huge capital infusion coming next year. We've seen this before. We've seen huge capital infusions. It happened during COVID, and we all saw what happened. And so again, there's opportunity there to leverage that to stabilize your organization or to grow and expand. It is the perfect time to self-disrupt and innovate. All right, I'm going to try to very quickly get through how do we take all of this and translate it into a plan, right? And I think I can get through this pretty quickly. So an operational plan, many organizations don't have operational plans, right? They have strategic plans, but they don't actually operationalize it. And so a strategic plan, if done correctly, is nothing more than a project plan for your organization. And that simply means structure it as such. You have your goals and your activities, but don't forget to add who's responsible, when's it due, what is the risk score, right? Where are we at with it right now? I just was doing strategic planning with an organization, and I asked them, like, are you going to take this strategic plan and use it to manage meetings? Are you going to say, hey, where are we at with these goals, right? And considering how you can use that plan and your goals and your strategies, but then put in accountability to make sure that they get done. This Bardock analysis is a great decision support tool. Forgive me, I know we're at our time, so if you need to drop, please feel free to do that. I'm going to try to wrap this up. I got 2 more slides. And so through this process, you identify your decision-making criteria up at the top. You assign a weight on prioritization because not all criteria is equal. And then you define your different opportunities, your different ideas, or your kind of priorities, what you're wrestling with, the decisions to be made. And then you can literally calculate numerically what each decision is worth, or what each opportunity is worth. And so you end up with a numeric value that allows you to objectively determine, oh, hey, this numerically became the number 1 decision, or got the most points based off of my criteria and how important those criteria are for me. Of course, it's just a baseline, it's just a temperature check. It doesn't make the decision for you, but it does give you an objective way to kind of consider the options that are at your plate. And then allocating resources. So again, going back to that definition at the beginning, considering the strategy is a guide for how we allocate resources. So the big aha here is included into the work plan, included into the process. Many of us are familiar with logic models and SIPOC diagrams and all that type of stuff. And so factoring in what those resources can be, those inputs, are they going to be people, finances, materials, equipment, technology, our facilities, our time investment? All of that helps us achieve and facilitate success in achieving those goals. Because again, you then take that and you monitor it on a weekly basis, on a monthly basis, quarterly basis, however you want to, but you then use it to track your success and progress towards your goals. I'm so sorry that we ran over our time. I tried my best. I will ask, if you don't mind, please tell us how we did. If you got your phone, do a quick QR code. This will take you to our customer satisfaction survey. It's also available on our website. I'll give you a second to do that. And then final slide before we adjourn is I want to tell you about some of the exciting stuff we have going on. So please take a quick screenshot. And all right, if you have not heard or you do not know, we do fun stuff. So this is an open invitation for you, your colleagues. These events are open for anyone that works in health and human services. So on December 19th, we're going to have a holiday happy hour. Your drinks are on me. So please come on down, bring a friend. Like I said, it's an opportunity to network, celebrate the success of the system, and get to know each other. We often are stuck in our buildings, right, and working. So it's just an opportunity to connect and have fun. Next month, our Power Hour is going to actually be on artificial intelligence. Very excited to talk about that and present it, help organizations kind of define their AI strategies and what they're doing. And then also in January, we're going to have our coffee and connection. So we rotate every month, rather do a happy hour or a coffee meetup. So all this information is on our website. Please feel free to check that out. And again, this PowerPoint and everything will be shared with all of you. I'll hang out for questions and comments, but thank you for joining us today. I really appreciated your time. And again, I'm available for questions if folks have them. All right. All right, no questions. We are adjourned. Thank you guys so much. Have a great day.